Hi, Don here. Welcome to Podiatry Practice Mastery. Want to chat a little bit today about the recap from the shockwave course here in Boston, which is December 2023. This is the second year I've been to this shockwave course, and I wanted to give a little recap for those that have never been to a shockwave course. So I went to my first one was last year, and I've had a shockwave in our office. We had it for multiple years. Kind of like a lot of people, we started out with a radial shockwave, and then we added a focused shockwave. We have two offices, so we have two radial devices and one focused device. So if someone needs the focused, which we call combo, I send them to our Westboro office. So first of all, what went well? What's nice about this conference is it's very upbeat. There's shorter lectures, there's some academic lectures, there's some practice management lectures. Today was mostly academic, kind of talking about how to do it. There's a time for hands-on where you can actually use the devices. I specifically liked a lot of the history behind how they take this technology and they use it for multiple different areas. And also another nice thing is that in the group there are chiropractors, there are primary care doctors, there's sports medicine doctors. There are many different types of physicians and non-physicians that are present that are using these modalities. So some of my biggest takeaways are number one is how to explain it to patients. I think what I've always said, and I'm going to tweak it, go up 2%, but I always say, currently I say shockwave, it's about 82%, I used to say 80, it's 82% effective, meaning it works 82% of the time, and it speeds up the healing by about 50%. So this is the way I introduce it to patients, because patients, they don't want something to hit their foot. What they want is they want to get better. So I say it's going to speed up your healing of your plantar fasciitis or your Achilles tendonitis by 82%, and it's speed up the healing by 82%. I'm sorry, it's 82% effective, and it speeds up the healing by 50%. So versus something else that's just going to take a lot longer. So patients want things quicker. 82% effective, and I do find that that's the case. And one thing I was thinking about, even as I explain that, I don't say anything about the treatments, and I'm thinking maybe we could even include that same thing as we're talking about orthotics, right? I find orthotics about 90% effective, right? And they reduce the recurrence of whatever condition we're treating, probably by about 80%. So I think that might be another way we can even explain orthotics. Because in my hands, maybe I get not even 10%. It might even be 1% that I have to adjust. So it's very, very few comparatively. So orthotics are 95% effective, and they reduce the recurrence of these issues by 80 to 90%. That might be another way of explaining it to our patients. So that's one of the takeaways. The second takeaway that I found was that I might be using the radial and the focused a little too intense, because many times if you have a machine for the radial, you start out high, like 15 hertz, but what they were recommending today was starting out even higher, like at 20 hertz, and really low at like 2 bars. And then, or even 1.5 bars, and then slowly increase it. Because what I've been doing is I've been doing 15 hertz for about 500 pulses, and then I go down to about 9 for the other 1,000 pulses. That's how I was doing it. And it seems like they're doing it a lot faster and a lot lower. So that's something I think I'm going to consider with doing this is the radial. And also what they mentioned is that in terms of the surface area that you're doing on, They recommended doing it on a dollar bill surface area, which is new to me because I was going a bigger surface area than that, and then doing multiple dollar bill areas. So multiple dollar bill areas of the 3,000 pulses. So they're doing about 3,000 pulses with the radial. Let's say you would do 2 areas. Let's say the posterior calf and then the plantar foot region. And then you would do it between 2 to 2.5 or going up to 2.9 depending on their pain level. You want to keep the pain level at about a 5. I thought that was a neat new thing for me. So using for the radial, the size of the area being like a dollar bill. And then in terms of the surface areas, I might do more surface areas. Another neat thing that I learned was that in terms of focused, the idea for the focused, once again, is doing it not as intense. But also the area that you're treating with the focused is the size of a quarter. So a much smaller area, moving it a lot less, being a lot more deliberate. I think I've been going over bigger surface areas with the focused, but kind of doing that much more intense. And then I'm going to keep doing the same 2,000 type of pulses. There are some good resources that they explain. They give you all the readings and things like that. So that was another neat thing, was in terms of explaining. They've standardized it up till now. The way I tend to do shockwave is I start out with 3 sessions, and then I do 6 weeks of physical therapy, and then I see them back, and I might do a few more sessions. They've kind of standardized it now with doing 6 sessions, so doing 6 sessions a week apart. The way I do shockwave is at the first session, I give them a physical therapy prescription to start when they finish. I've been doing 3 and then doing 3 more if needed in the future. But they recommended kind of standardizing it. So those are a couple of the good things that I've noticed that are kind of refreshers in my mind. One thing I think that I'm doing well is that I was talking to some other doctors. There's some doctors that are doing a lot of MRIs to help guide the shockwave treatment, and I think that ultrasound really, really works well in our hands in terms of showing the pathology on the right foot, comparing it to the left foot, and then showing the need for shockwave therapy based on that. They did focus a little bit about biologics. There was someone there that was explaining about PRP. Currently, we use amnio in our office, but talking about amnio and then PRP as additional adjuncts. I'm still not really clear of how to explain that and shockwave, because it seems like we have too many things to offer. But what they say is that the amnio, the way I kind of explain it is shockwave stimulates your own stem cells, and then it's potentiated by the amnio, injecting it right into the injured area to bring healing. So those were some of the ideas from this shockwave course. It was nice to see a couple of other podiatrists there. A couple of the areas that I think I'd like to treat more of is they have some neat protocols of doing neuromas, which up to this point I really hadn't had the best success for neuromas. And I was talking to some doctors about neuropathy, and as well, there's not much great success with neuropathy. But the tendinopathies, the plantar fasciitis, the insertion Achilles, proximal to the insertion, those types of things are doing well. And I think what always happens after coming to one of these courses, I tend to do it more. I'm going to be adding a section to my, what I call the Practice Mastery Wiki, or Practice Management Wiki. You can get it going to podiatrypracticemastery.com/wiki, W-I-K-I. And in there, I'm going to put a lot of the notes here from this course, some of the picture slides talking about different therapeutic regimens for doing things. And I'm going to tone things down. I think I was going up way too high with my patients, and they were hurting a lot more, and maybe it wasn't necessary. So I think I'm going to have a lot more uptake with patients, and I'm thinking I'm going to switch it from 3 to 6. And then talking about pricing, we tend to do 200 for focused, 200 for radial, and 250 if it's focused and radial. And I'm still unsure of EMTT. There's a lot of good examples of how to use EMTT as well. We are currently not doing that. I think it's a way you could do it in conjunction, kind of like the way people use MLS laser or using one of these other laser modalities. That's like creating electromagnetic field. That's what I liked. What I didn't like, there wasn't much. I was feeling a little under the weather, but there wasn't really much I didn't like. I thought it was a good conference. And there's going to be another day tomorrow, which is going to be talking a lot more about the practice management aspect. A couple of the good resources that you might want to consider. My favorite lecturer there is Paul Holbrow. He is from England, and he has a kind of a coaching program on using shockwave. So if you want to learn how to explain things, he's got a lot of good videos on YouTube and other good resources. And there's International Society of Shockwave as well. So these are some good things. So let's talk about what could you do with this. So if we're talking marketing, I've always talked about creating your target market, or what are the main things that you want to do in your office, and what are the main revenue producing items in your office. And for us, certainly, we've actually reached a point where we have 50-50. So we have 50% revenue from insurance and 50% from cash pay services. And that would be orthotics, amnio, shockwave, and things like that. And so this has to be one of the things that's going to be up and center on your website in terms of treating non-surgically shockwave. One thing that really helps me are my patient presentations. So if you haven't looked at those, you can go to patientpresentations.com. And I have them on plantar fasciitis, for example. And if you click the shockwave, there's a couple of slides that explain about what it does, kind of what's the science behind it. Now, one thing I learned from one of the colleagues that works with me, what she does is she has the patients actually take a picture of that slide. So if they need to explain it to someone, it explains how shockwave works. It stimulates your own stem cells. So a lot of times they want to explain this to someone at home, and I think that's an easy way they can take a picture of that. That's one thing. Another thing you might want to consider is that when you're in the office and you're talking about different types of treatments, you could talk about regenerative medicine, because it seems to be kind of in the trend right now is like regenerative medicine or stem cell, or getting better without surgery. So you could even create a little booklet kind of about like how to heal your foot pain without surgery or something else like that. You could talk about a lot of these your focus areas. Like for me, that would be shockwave, amnio, orthotics, and other things like that. Anyway, those are some ideas. Let me know what your thoughts are, and I'll tell you more about the next session tomorrow.